All right, well, this will be my first official video on YouTube, besides some other updates. For those of you who don't know me, my name is Jack. I am a nurse, surgery center in Boise, Idaho, and just recently diagnosed with cancer. Yay. So I thought I would use YouTube as kind of a platform to document my journey. One, get things out, kind of be therapeutic. Two, maybe help somebody else along the way that has just been faced with the same struggle. So I figure it's a win-win. But in this video, I am going to talk about kind of the symptoms leading up to diagnosis, which then diagnosis will be the second video. So I'll just kind of run through things that went on that didn't seem right. And, well, for you nurses out there, you know nurses are the worst, especially guy nurses, at seeking medical attention. So this will also address that. But it's been, God, several, 4, 5, 6 months, just something wasn't right. I've been exhausted, not sleeping well, but I work a lot, tons of life stress, so just attributed everything to that, and I don't sleep well, so that also causes other issues. So just kind of put everything in that little box of just I'm tired, I'm worn out, I work a lot, 3 kids, stress. It's just stress. It'll go away. Meditate. Go on some walks, start eating right, everything will get better. But unfortunately, the exhaustion kept getting worse. Led up to, it was about May, I was having some increasing abdominal pain. I've had some other health issues in the past with fatty liver, so I was just pushing it off all on that. It's probably just my fatty liver popping up. It'll go away. It'll go away. And then the exhaustion, and I had a day where, it was May, just something wasn't right. Pain was getting worse. It's all my lower abdomen, bloated, very like cramping almost, lower abdomen, right-sided pain. So I ended up going to the emergency room to see what was going on, because you know when things aren't right, when you really listen to your body. And talked to the doctor, and they put me in the CT scanner, and about 20-30 minutes later he comes back. It was actually really quick, quickest ER visit ever. And saying that I had like a 3.8 millimeter kidney stone in my left ureter. But they also noticed some lymph node swelling in my abdomen, and it's probably just swelling from your kidney stone. But you'll pass your stone, everything will be good. It's like, oh, at that moment I knew I've had many kidney stones in my history. So I knew this wasn't kidney stone stuff, but man, it was on there on the CT, so I rolled with it. Eventually, after 2.5 weeks, that stone finally passed. I gave birth. It was miserable. The kidney stones suck. If you've never had one, don't. Make sure you're drinking plenty of fluids, lemon water, stuff like that. Get your citrate up. But anyways, so past the kidney stone, and none of my abdominal symptoms cleared. They were actually getting worse, to the point to where I am a side stomach sleeper, and I couldn't sleep on my stomach because of the pressure and pain. But I followed up with the urologist. Supposed to do a 24-hour urine study, which we were moving in the time, so I never got the kit, so I never ended up doing the study. But he asked if there's anything else that I was concerned about, and I was like, well, what about these lymph nodes? He's like, well, it's probably just from inflammation from your kidney stone. I wouldn't sweat it. First lesson, folks, always go with your gut. Even if it is a doctor telling you, don't worry about it. I am my own worst advocate. I don't know if it's a guy thing or a guy nurse thing, but I just kind of dismissed things with that. And I was like, oh, okay, well, we'll see what happens and see if it clears up. Didn't clear up until it was in August. Beginning of August, first week, it was like 1:30 in the morning. Something wasn't right. I just had this horrible feeling like something's really not right. The pain, I can't sleep. The bloating was getting worse. So I dragged my ass back to the emergency room at 1:30, 1:45 in the morning. And talked to the doctor at St. Luke's. Super nice doctor. I can't remember his name. And I had a nurse from Brazil. He's a cool guy. But I explained the story, what was going on. I was worried about these lymph nodes. But the first scan, they did not do it with contrast dye. So it was just a regular abdominal CT. So it's limited on the study. But there was a pretty big note in there that the radiologist put on my original scan, that concern for cancer. I'm good at ignoring things, I reckon. So he repeated the CT, but this time with contrast. And this visit took a little while longer. It was probably about a 4-hour visit, but he came in and I could tell instantly by the look on his face what was up. So he sat down and we had a chat. Some of the lymph nodes that were enlarged were now showing possibly necrotic. Other lymph nodes were much larger. And there was a spot on my terminal ileum, concern for cancer. So he pushed through a referral to a GI doc for that week so I could get in to get a colonoscopy and a biopsy. So that Friday, I ended up getting in with a fantastic GI doctor. She was amazing. Did the prep sucks. Oh my God. Go lightly, it's more like go violently. Now, other than the prep, colonoscopies these days aren't that bad, so go get one. I mean, not for recreation or anything, but for regular health screenings, definitely get one. So this doctor, I don't remember. I was under Versed and a touch of propofol, I imagine. So I don't remember her coming in and telling us. My wife does, though. But I guess she came in and said, yes, it looks like it could be lymphoma, and I have a pretty good size ulcer in my terminal ileum, and we'll have to, officially wait for pathology before we call it anything. But if it walks like a duck, talks like a duck, it's probably a duck. So, yeah, I woke up at home, and that's when everything kind of hits you like a brick. The in between all the scans and not knowing, and they throw that cancer word out there. Having been through it now, it's words can't describe the feelings that you feel. It's surreal, and the waiting and not knowing, and but we'll get more into that in the diagnosis part. This is just symptoms and the process that led up to my diagnosis. I want to touch on some of those more deeper topics in that video. But yeah, waited for a pathology, and then I got a pathology report that on that Tuesday, or she called Monday, and said, yeah, it's diffuse large B-cell lymphoma, which is a non-Hodgkin's lymphoma. It's fairly aggressive. I have the aggressive type. So we need to start things immediately, which then led to referrals for oncologists and dealing with insurance companies and in-network, out-of-network, and oh my God. So I chose to seek care at a hospital that is not in-network, just because they're the hospital you go to when you have cancer. Working in healthcare, you know where you need to go and where you need to stay away from. Especially working all the hospitals in the valley, I know where I need to go and where I need to stay away from. And certain things are fine at one, and other things are a must at the other. So we made that decision, and through St. Luke's Cancer Center, they have been amazing at getting me in quickly, because originally my first appointment was going to be on the 26th, just to get in to see the oncologist, not discuss treatment or anything like that. And this needed to happen like a long time ago. So he got me in last week. I met my oncologist, who is an amazing doctor. This nurse has been phenomenal. Everything is super well organized so far. I'll do some more treatment updates and all that stuff, so I'm sure it's going to be just fine. Everything's like a well-oiled machine up to this point. But spoke with doctor, and he explained all about the lymphoma. This appointment was like an hour and a half. Met all of my questions, my wife's questions and concerns. Spent plenty of time getting everything lined up and pushing tests through. So all my testing for before treatment, I needed to get a chest CT, a PET scan, an echocardiogram, and a whole host of blood work. But apparently there is a national shortage on the isotope for PET scans, so I was not able to get in to get a PET scan to get an official staging. But he explained that if it's localized in my abdominal, that word is killing me, abdominal lymph nodes and intestine, then that would be considered stage 1, 1E, because it involved other things. And technically, intestines are not considered an organ when it comes to staging. But if they did the chest CT and I had any nodules above my diaphragm, then that would put me in stage 3, 4, depending on the extent. So thankfully, my chest CT was completely clear. All my labs were good. My bone marrow biopsy, I have not got that back yet. So that's the last thing we're kind of waiting on for staging, because if it's in my bone marrow, that's going to push me way up. But as it sits right now, things are looking good if it responds to treatment. So if this chemo I'm getting does a good job, I should be doing quite well. The chemo I'm going to be doing is the standard treatment for lymphoma. It's called R-CHOP. It's I don't know all the medications right now, but it's an acronym. Last medication is, well, the first ones are like rituximab. That's the brutal one. And then there's another brutal one that supposedly turns your pee red. That's the one that makes your hair fall out. And I think the rituximab makes your hair fall out too. The last one's prednisone, so I'll be doing high dose prednisone with all that and a whole host of other antiemetic medications to keep me from throwing up and all that good stuff. So barring how many symptoms I experience during chemo, hopefully it'll be a pretty straightforward treatment. And but because of where my ulcer is on my terminal ileum, I am not a candidate for direct radiation, because usually they'll do 3 treatments of the chemo and then a direct radiation treatment on tumors. But I do not fall into that group, so I will be getting the 6 treatments. And treatments will be, my first one's going to be a long one because I need to make sure I don't have any reactions to the medications. So I'm looking at probably about 8 hours, 8 or 10 hours, more longer if I have reaction, 6 to 8 hours if I don't. And then that repeats every 21 days. So I'll be doing 6 cycles of that. Hopefully halfway mark, they'll have some isotope and I'll be able to get a PET scan to see how I'm responding. And then they'll do another PET scan at the end to see how everything's going. You get lab work drawn, check on your platelet, RBCs and all that stuff before chemo, because this stuff decimates your immune system. So if there's any issues with platelets or anything like that, that might delay my treatment. Which the first one my blood work's good. I was on a high dose dexamethasone 4-day thing for when I went in to get my port put in. My white blood cells were like 27,000. They're up there, but that's normal from that medication. So with treatment coming up, tomorrow I get my echocardiogram to make sure I have no cardiomyopathy, because one of the medications can cause some cardiomyopathy, which wasn't a super good news, because he says it can happen on any of the infusions, or it can happen 2 to 3 years after treatment, or it could happen not at all. But they just want to get a baseline of my cardiac function as it is now to kind of track things during treatment and down the road. So yeah, it's been a lot to take in, a lot to research. It's kind of a lot. It's a lot. All that stuff. And then while all this stuff's going on, life is still going on all around you. So that piles up on top, and then all the emotions. But again, we'll get more into that, into the diagnosis. After your diagnosis video. But those were my symptoms leading up, and kind of the process that got me up to my official diagnosis and up until I am going to start treatment. So it's coming up in 2 days, and I am ready to get the show on the road, to get better. So I will be posting some more videos, longer format, about this process. So hopefully you're not watching these because of your own personal interest, because of your diagnosis. Wouldn't wish that on anybody. But if you are, join me for the ride, because I'm learning a lot about a lot. And if there's something I can do to put out on a video that'll help you learn too, then this will all be worth it. But anyways, thanks for hanging out, and I will get the next video out. I'm pretty tired right now. I'm gonna go try and sleep, get ready for my test tomorrow. But be well.